Skin sagging on the face and neck is one of the most common complaints as we age. No one wants to inherit their mom's turkey neck or see their sagging jowls when walking past a mirror. And other than wrinkles, gravity is the most common aging issue our clients want fixed. And honestly, until just a few years ago, there weren't good solutions other than plastic surgery. The greatest thing that's happened in this industry in the past couple of years is the advancements that have been made on fat reduction and laser skin tightening. LaserLift, or the Side Laze Precision TX laser, really is the exact same laser with two names. LaserLift offers natural results that are just short of a facelift for most people, but with about a third of the cost and downtime. For someone looking for the absolute best tightening without major surgery, then LaserLift is the best treatment available. Besides very little downtime and less cost, there are several more advantages to LaserLift versus a traditional facelift. The first one is there's no general anesthesia, which is great because that's the biggest risk of any surgery. Instead, we numb you with tumescent anesthesia, a type of local numbing medication. The second advantage is the laser melts or liquefies the fat before we do the suction, so that makes the procedure way more gentle if we're removing the fat under the chin. And the third advantage is the laser has a temperature guide on it, so we heat the skin to a certain temperature so that you get skin tightening, and that's really important. Although there's always some risk of skin sagging, everyone gets skin tightening with LaserLift. Obviously, like it is with all things, the younger you are, the more skin tightening you get, but we've treated people of all ages. Here's how it works. LaserLift has 3 steps. First, on the day of your procedure, most patients take pain medication and something to relax them. So, if you take the medications, you have to have a driver, someone who will drop you off and drive you home. We do the procedure right in our office. After prepping and cleaning your skin, we take you to a sterile setting and we make a few small 2mm incisions, which are really just tiny punctures under the chin and towards the back of your jawline. Through these punctures, we infuse numbing medication into the neck and the lower face. And when that's done, your skin is completely numb and you can't feel a thing. Then we use the fiber optic laser to heat the skin to a specific temperature, to heat up and melt any fat under your chin and then heat your skin so it will tighten along your lower face. Generally, you don't feel this at all because you're numb. Third and the last part of the procedure is gentle suctioning out the melted fat. You may or may not have a couple of stitches. Immediately after the procedure, you're groggy if you took the medications, and you might not remember much, but this is temporary, just until the medications work out of your system. We do have you wear a head neck wrap for compression for 3 days around the clock and another 4 days at night only, and it looks like this. You come into our office for a recheck about 3 days after your procedure. Honestly, recovery is really easy, but this is a surgical procedure, so you may feel bruised and tender. It's rare to need anything for pain after the treatment, but it varies dramatically from patient to patient. 9 out of 10 times our patients only take anti-inflammatories for the pain. And it's unusual to have much swelling or bruising. By day 4, patients are back to normal activities and back to work, and the results just keep getting better for 6 months. Fortunately, complications are generally low. As with all procedures, there's some risk of infection, but we do this in a sterile setting, and we put you on an antibiotic to minimize that risk. You'll probably have some skin numbness which goes away after a few weeks or a few months. Let's talk about results. The best results are seen at 6 months, but you'll probably see something within just a few days. At 6 months, that's when all the skin tightening is complete. LaserLift is best for people who are showing the common signs of aging, sagging jowls and turkey neck. However, it's important that we discuss your expectations during your consultation. And we can't do LaserLift on smokers or anyone who uses nicotine in any form. There are a few medications that interfere with the local anesthetic and increase your risk of clotting. So we'll look through your medications and may stop some of them for a few weeks prior to your procedure. Dr. Lowe has performed hundreds of LaserLift procedures, and he's worked with this laser since 2009. I'm proud to say we've trained with some of the LaserLift pioneer physicians, like Dr. Barry DiBernardo in New Jersey, Dr. Stephen Mulholland in Toronto, Dr. John Millard in Denver, and Dr. Roger Basson in Orlando. LaserLift was even featured on the doctors as a LaserLift procedure that doesn't require anesthesia, fillers, or sutures to tighten loose aging skin. Take a look at our before and after gallery. I think you'll be really impressed with our results.